Tracy said, we are partners in this community, and we're so happy to be a part of it. So thank you for your referrals from your Saturday programs and for connecting with us, because we want to be able to serve you better as a community clinic. So I'll tell you a little bit about Culmore Clinic, and then we can answer some questions afterwards, and we can hear from United Healthcare as well. So feel free to raise your hand, shout out questions as we go, but hopefully I will be able to answer them as we go through. So we, as Culmore Clinic, we are a nonprofit organization. We are an interfaith organization. We have more than 17 faith communities that support us, including Al-Hijrah, including a temple, including lots of different other Christian organizations as well. And we are very proud of the diversity of support that we receive, because our patients come from a diverse backgrounds of different places, and we want to be able to represent that in our organization as well. So thanks to Al-Hijrah for the support that they provide as well. We offer health care for adults, so anyone over 18, and it is free health care as long as you are uninsured, no insurance, and that you meet one of the financial qualifications. But that's it. Otherwise, you can live anywhere. We don't have any questions about immigration status, or if you work or you don't work. It's just if you make under the 200% of the federal poverty level and you don't have insurance, you are welcome at Culmore Clinic.
Allison?
Yes.
They can live anywhere or have to live in Fairfax County?
You can live anywhere. We prefer that you live in Fairfax County only because, that's a good question, only because some of the partners that we use, the radiology places that we send for free mammograms or x-rays, some of them, or the hospitals, some of them require that to get their services for free that you are a Fairfax County resident. So it makes it a little bit trickier if you are not, but we will see you and do our best if you live somewhere else. And we encourage folks, there are free clinics and community clinics around the area. And so if you live in Herndon, we might refer you to the Herndon Clinic if it's closer to you. But if you come and are here at Al-Hijrah, or you work in the area and you want to come to Culmore Clinic, you're welcome to. So that's not a hard thank you, but it's a good question because it's helpful to be a Fairfax County resident so you can receive the full services that we offer through the community. The need in this neighborhood is great, and it's growing. We will have more folks who are insured through Medicaid, but we also have a large immigrant population here, and we want to serve those who may not be residents yet or citizens. So we know there's a gap in your care when you don't have insurance or you can't access Medicaid. So that's why we're here. Some of the statistics around this Bailey's community make it hard for us to access health care if we don't have a car. The transportation program here is amazing. In fact, I might want to take advantage of that for Culmore patients. So if you don't have a car, how are you going to get somewhere? How are you going to get your blood work? So we try our best to provide as much as we can on site so that you can walk because it's close by. We're located within Columbia Baptist Church on Glen Carlin Road. So at the corner of Glen Carlin Road and Route 7, where there's St. Anthony's Church and the Rite Aid, we're just down that street, and we operate within that church. And so it's in the neighborhood. There's a bus stop close by, but we know that transportation can be tricky. Also, when you're sick, it's hard to work. And so we know that. We want to help you to maintain a job and your health care so that you can do both at the same time. And then English speaking is, fewer people in the area are English as their first language. And so we take great pride in our interpreter services. So we have interpreters in Arabic, Spanish, Vietnamese, who are regular on site. If someone comes and speaks a different language, we do our best to find someone to interpret for them. Because we find in healthcare, it's hard to have a family member translate for you. We want it to be a confidential experience where you can talk with your provider directly with an interpreter from Culmore Clinic rather than have someone from your family come and interpret for you and maybe sensitive information. So just know that if English is not your first language, we do have interpreters for you at the clinic. We have been around for more than 10 years. We've been in different locations throughout the Culmore region. We started here at Al-Hijrah for a few months. We had planned to be in the county facility across the way, the Culmore Resource Center, but our partners here at Al-Hijrah helped to set us up here first. So you were our first home, which is kind of nice. And then, yes, thank you for that. And so then we moved over to the Culmore Resource Center, and then eventually into, which is behind the Rite Aid, and then eventually into Columbia Baptist, where we are now. We may be moving again next year, probably March, to somewhere close by again. And so we are grateful to the support of the community to host us so that we can be as close as possible to where the need is. And so for 10 years, we've been doing this. We started as a one-day-a-week clinic, and we've seen the need for primary care grow and grow and grow. So instead of being like an urgent care, like a place you would go just for one need or one thing, we now are open 2 days a week. We provide comprehensive services. So we provide any of the primary care that you would get at a doctor's office. Just happens to be mostly free. So you can get your blood work, you can get your mammograms, your bone scans, you can get other testing, and we refer for specialty care as needed. As I said, we're growing. So we are growing to meet the need that the community has. So we've hired some new staff. We've gone to a second day. We offer group classes, which have been really beneficial to a lot of our patients. There's education in a group setting with your peers, so you can learn from each other. How do you take care of your diabetes? How do you change your diet? What kind of exercise do you do if you've never exercised before? It's helpful to hear from each other what kinds of things have been helpful. And those programs have provided us with some great results. Half of our patients have lost weight in this program. 80% have lowered their blood sugar or their cholesterol. So we're making changes because of the kinds of healthcare we're able to provide. And we're continually looking at that to see, are we doing the best job that we can with the minimal resources that we have. So it's sort of creative healthcare in a way. And we do offer PAP testing on site for female exams. We offer screening exams for other types of cancer as well that are recommended. Again, this is a list of things that we provide on site. We've sort of mentioned most of them, but basic medical care. Counseling is a big thing. For a group our size, not every clinic has a counseling or behavioral health program, but we find it's very important. Most of our patients are struggling with something. All of us are struggling with something that causes anxiety or causes stress, and how do we get that out, or how do we treat that? And counseling is a great, great way to do that. So we have some volunteer counselors who are amazing and very approachable. They'll sit with you and talk through what's going on and make recommendations for your lifestyle. So that's something that we're very proud of. As I said before, we can do laboratory testing, any kind of x-rays. We work to do any preventive screenings that you might need. So we take care of your health ahead of time. So prevention is really where we should be working, so that we're not treating disease, but we're preventing disease. And that's often what's left behind for someone who doesn't have insurance, because you're not going to pay to go to the doctor unless you have a problem, right? So we're trying to prevent that, so you're not having to go to the emergency room at the last minute. We offer physical therapy on site. Dr. Mostafa, who is from Al-Hijrah, is volunteering with us every week on Thursdays. He comes and sees patients for physical therapy, which is a great service. As I mentioned, our medical visits for diabetes, our interpretation program, and other education that we do on site. We also offer flu shots for our patients, and so if you're a patient of ours, you would get a free flu shot, but it's also nice to have that option here too if you are not yet a patient. So this is very small writing, but you can see the number of partners that we have. in the community. We do this work with only 5 paid staff people and over 70 volunteers. And so we depend on volunteers and donated gifts and services so that we can make the clinic work. So the different churches help us, the mosque, Fairfax Radiology, other medical societies in Northern Virginia. The hospital systems donate certain things to us, and so we're able to refer people. We do some dental care. We've done a program where we had once a year, we work with Hope for Tomorrow, which is a group that goes with mobile units to set up a dental clinic. And so they take their van and they have all their supplies. They come in and set up for the day and they see patients. And then we refer patients to local dental organizations like Neighborhood Health in Annandale. Financial support as well. We have a long list of folks who support us financially, and that's how we operate. It's organizations, it's individuals, and we also write grants to receive the funding that we need. So what to expect if you wanted to become a patient at Culmore Clinic? This is probably the most useful information for you. The only 2 eligibility requirements, as I said, you have to be uninsured. So as we said, there will be folks who may become insured because of the expansion of Medicaid. So that would be a different program, and we could also help you get to a community clinic that accepts Medicaid. And I'm sure we'll talk about that too. But as far as until you have that insurance, or if you don't qualify for that, you're welcome to come to Culmore Clinic. And then you have to be under 200% of the federal poverty level as your household income. So all those in your house who make an income. So what's the first step? Call for an appointment. I have brochures here, and I have 2 flyers here in Arabic and English, and there's a phone number on there. Call and leave a message. We get a lot of calls, and I know it's frustrating to not get an answer right away, but the best way to hear back from us is to leave a message with your name and phone number and that you would like to become a new patient. And mention that you are part of the Al-Hijrah community, because we like to make sure that we're supporting those that we partner with and make sure we're making that connection. And so then you will get a call back from our front desk scheduling, and then there's a process for eligibility and for getting to be a patient, which takes about a month, which is a little bit of a wait, but once you are enrolled as a patient, you can get an appointment anytime. So if you call the week of, we can fit you in. If you call that morning on a Thursday, we can fit you in. So it's a little bit of a process to go through, but like I said, once you are a patient, you're welcome anytime. And we're open on Tuesdays and Thursdays right now. Tuesdays and Thursdays is when we see patients. So the 4 appointments that you'll have for the first visits is you'll do eligibility, which is just you sit down with our eligibility counselor. You bring your materials with you that they'll tell you to bring. If you get paid in cash, you'll just sign something that says, I get paid this much in cash. If you get paid with a pay stub, you bring that in. If you live in a house where your name is on one of the bills, bring it with you. If you have a photo ID, bring it with you. And we'll work with you to get the documents that we need, because you don't always have everything in that order. So we just need a few documents to make sure that we're collecting the information that we need. Then you will do a counseling visit. So we like all of our patients to be able to meet our counselors, and they do a questionnaire that says, how are you doing? Besides your physical health, are you safe? Are you happy? Do you have a job? Do you have food? Do you have transportation? What are the things that we can help you with that are not medical necessarily, but that affect your health? And so we really want to make sure we find all that out ahead of time. Then you'll see one of our nurses. So typically we do the first 2 in one day. You do the eligibility, financial, and the counseling. Then you come back another day and you do the nursing, medical intake, and you see a provider for your first visit. So you'll see the nurse. You'll bring all of your medications with you if you're taking medications, and they will do a history for you. when was your last exam? Have you ever seen a doctor? Did you have health insurance before? And what concerns do you have for the doctor? Then you'll see the doctor. You'll get a physical, you'll get blood work, you'll be able to answer any questions you have, and then you'll become a regular patient of ours. And you'll be seen as needed for any follow-up. You'll be offered any of the programming that we do. This is just it's small, again, you probably can't see, but it's just our statistics. We capture a lot of data so that we can tell people what we're doing, and we can follow ourselves and say, are we doing the best care that we can? And we see about 1,500 visits a year, provider visits or nursing visits, all of them combined. And we do about 200 or 300 referrals to specialty care in the area. And as I said before, we do all of this with mostly volunteers. So you can see up here the 5 blue boxes are paid staff. These are all of our staffing. And the green are volunteers. So all of these are key people to the organization, but most of them are volunteers. And most of them are part-time. So we do all of this on a tight budget, but we do what we can. And thanks to partnerships and community support, we can do a lot. So that's sort of the overview. I'm happy to take questions if you have any, and then we can go from there. Yes?
Yes, I know you said no insurance, but you mentioned something about the dental. Medicaid doesn't cover a lot of the dental that's needed.
Right.
So how would that work?
That's a good question. So if you have Medicaid, you wouldn't be able to be a patient of ours, but we refer to Neighborhood Health, which is a community organization. They have primary care, they have children's care, and they have dental care, and they do accept uninsured and insured patients. So what we would do is probably help you to get to Neighborhood Health, even not as a patient of ours. And that's probably something they could help you do here at Al-Hijrah as well. And Neighborhood Health, I think it's a sliding scale. So maybe you pay a certain amount per visit, but then it doesn't matter what you get done at that visit, but you just pay a certain fee. So that would be my best recommendation is Neighborhood Health Dental, and the closest one is in Annandale. Good question.
Did you offer TB screening or TB test?
Also a good question. We don't do it on site, but we can connect you with the health department to do that. And sometimes there is a fee, and we can help with that as well. We don't do it on site right now.
And it's a cross question to that. So are you offering school physical?
We are not. We only see adults. So it's 18 and over. So if you need a physical for another reason, work, or you need a medical clearance for something, we could do that as an adult. But we don't do the school physicals. I believe the George Mason MAP Clinic does, and they operate in the Culmore Resource Center, and we actually might be locating with them in the same space when we move in the spring. So that might be a little easier, but they do see children there, and they connect families with childcare, with healthcare for children. So that would be my suggestion there. They operate on Thursdays. You just walk in, and they could connect you for kids. So again, I would recommend going through the George Mason MAP Clinic, and that's in the Culmore Resource Center behind the Rite Aid on Thursdays. They don't do the immunizations there, I believe, but they would refer you to, there are a couple organizations in the area who would do it. Medical Care for Children Partnership, MCCP, is one that does care for children and immunizations. And also the MAP Clinic has folks on site who will enroll children. So a lot of children are eligible for Medicaid, even if their parents are not. And so they'll help you to determine if the children are eligible for insurance, and then they can go to any provider that accepts it. So that would be my recommendation as a first stop. Mm-hmm. Other questions? Well, thank you so much. I really appreciate your time, and feel free to call us. My information is here. You're welcome to call or email. This is my personal email for the clinic, so if you have a question, you can do that. This is the clinic phone line. So like I said, the best way is to leave a message, and you'll get a call back. And if you don't, tell Stacy, and she'll tell me, and we'll make sure we get it all together. Okay?
Thank you so much. Culmore really is a great friend to Al-Hijrah. They have very wonderful volunteers, very compassionate care. There's a prayer room there if you're there for your medical care and it's time to pray, that's made available to you. So they're really wonderful and a great partner. Thank you so much.
I'll sit in the back.
Okay, good. I know it's getting chilly in here. I've asked maintenance to turn it down. They're the only ones who can. Okay, thank you. And so I'm going to turn it over to Julio now to give you a better update on the Medicaid coverage.
Assalamu alaikum. Well, my name is Julio Martinez, just like Stacy said. I got some information, I got some information here about United Healthcare and some of the services that we provide. If you can pass it around, please. And also, I have some brochures about keeping your heart healthy, okay? Well, just like Stacy said, there will be some changes coming up to Medicaid, okay? Do you have one? Okay, let me just wait. Thank you. Everybody has one now? Thank you very much. Thank you very much. Okay, so I'm a community outreach specialist for United Healthcare, which means that I work with the community in general, informing them about Medicaid, how to apply for Medicaid. I do health education classes as well. Thank you. And inform you about changes like the ones coming up about Medicaid. Well, there are a few changes. The first one is that in Northern Virginia, in the region that we are, traditionally Medicaid has had three Medicaid plans, three MCOs, three managed care organizations, which were in Total Health, Anthem Health Keepers Plus, and Kaiser Permanente. Okay? So starting October 1st, Kaiser Permanente will no longer service Medicaid. And there will be 6 health plans instead of 3. Okay? They will. So like I was saying to you, there will be 6 MCOs, 6 health plans. Total Health was purchased by United Healthcare, so anyone who has Total Health will now be a member of United Healthcare starting October 1st. Okay, so United Healthcare, Anthem Health Keepers Plus, Aetna, Regina Premier, Optima, and what's the other one?
Medallion, is that one? Medallion one? Or is that Medallion?
The other one is similar to that name. But anyways, the plan The Medicaid plan is called, Medicaid is called Medicaid 4.0, which will start in October 1st. Enrollment for Medicaid starts October 1st instead of August, which was traditionally held in August, will be now October 1st. So in Northern Virginia, what the state has done is that they don't want any health plan to have a monopoly. So there will be about 36,000 Medicaid members that will be switched over among all the Medicaid health plans, among all the 6, starting October 1st.
Okay, I'm sorry, I'm having problems hearing you clearly. Can you say it one more time?
Okay, there will be 36,000 members, or 36,000 people who happen to have Medicaid that will be switched over to another health plans.
Okay.
So anyone who has Medicaid, they should have gotten a letter letting them know that their health plan, their NCO, might be changed. Okay? So, for example, if you happen to have Untitled Keepers Plus, you might have gotten a letter saying that your health plan will be switched over to the other one of the other 5. Now you have 90 days, okay, from October 1st to decide whether you want to stay with a health plan or you want to switch back to the old health plan that you had. Okay, 90 days. Now, the other, oh, by the way, anyone who happen to have United Healthcare, in Total Health, will be not switch over, the name change. It's going to change to United Healthcare, and I just want to let you know there will be no changes on your benefits. Everything will remain the same, everything will stay the same, yes.
Okay. I'm sorry, I should have waited till the end till you finish.
No, that's okay, go ahead.
So I have Untitled Keepers Plus, and my son has in Total Health. So
Uh-huh.
you said that would be changed to
Then,
United?
okay, anyone who has in Total Health will be now United, starting October 1st. But nothing else is going to change. Benefits will remain the same. Services will be just as good or maybe better. Okay? So nothing's going to change. Now, the other changes is the state things got decided to expand Medicaid, which means that approximately 400,000 people or more who didn't have Medicaid would now qualify. Okay? Before an adult, in order for an adult to qualify for Medicaid, they had to have 3 things. Either the person had to be very poor and make about between $600 and $400 a month. Who survives with $600 a month? So, but anyways, then to qualify for Medicaid in the state of Virginia, or the person has to be age old, blind, or disabled before to qualify. Now, since the state decided to expand Medicaid, anyone making approximately $1,700 a month, which translates to about $8.50 an hour, will qualify for Medicaid. Okay. Now, in order to qualify, you have to be a legal resident, a citizen of the United States, or a refugee. Okay. The program, the enrollment period for this expansion starts November 1st. So anyone who thinks who qualifies for Medicaid and as an adult and wants to apply, the application process starts November 1st. Now, the services per se itself will not start until January 1st. Okay? You apply November 1st, you will start receiving the benefits, the insurance benefits, January 1st, 2019.
So is October 1st is the deadline for anything?
October 1st is the deadline where Medicaid is going to expand to 6 NCOs in the area. Instead of 3, there will be 6, which is Magellan was the other one.
Okay.
United Healthcare, Anthem Health Keepers Plus, Aetna, Virginia Premier, Optima, and Magellan. There will be 6 health plans instead of 3. Before there were Internal Health, Anthem Health Keepers Plus, and Kaiser Permanente. But starting October 1st, Kaiser will no longer service Medicaid. And all the members who happen to have Kaiser will be divided among the other 6 MCOs. Okay? Also, the members who happen to have in total health, like I said before, the name is going to change to United Healthcare because United purchased in total health. Okay? Which is the organization that I work for, United Healthcare. Now, like I was saying to you, if you are an adult and you're making less than $1,700 a month, and you think, and you meet the other requirements, meaning that you are a resident, you are a citizen of the United States, or that you are a refugee, then you can start applying for Medicaid November 1st. Okay? Any question?
So, if you don't say anything and you have Anthem, like I do, then they're gonna change me over to.
If you haven't received a letter saying that you're gonna be switched over, okay? And it's time for you to renew your Medicaid, meaning that open enrollment starts now in October 1st, and you don't do anything, you still will remain with Anthem. Okay?
Okay.
So you won't be switched over unless you receive a letter specifying that you're going to be switched over to another health plan. Okay?
Will they change the doctors too? That's one part?
No, the doctors will be the same. Now, if you of your child happen to have Anthem Health Keepers Plus, okay? Because the plans that will be affected in Northern Virginia specifically are Anthem Health Keepers Plus and anyone who happen to have Kaiser Permanente. So, if you have Anthem Health Keepers Plus and you receive a letter specifying that you will be switched over to another health plan, and you decide that you want to stay with a new health plan, you will have about a month. Okay, so if the doctor you have does not participate with a health plan, you have 90 days to decide to switch back, or you have a month to decide whether you want to stay with a doctor, okay, or find a new one, because a new health plan will cover any medical expenses with a doctor for 30 days. So the care to the doctor will be extended for 1 month, then you have to choose and look for another provider within that health plan. Okay?
Now, if you go to a specialist like pain management, and you have a pre-authorization with your insurance, do you have to get a new pre-authorization once they change you, or once?
No, the pre-authorization if I'm not wrong, will be covered for 30 days as well.
30 days, so not the year that they give you, you have to.
No, for 30 days. Only if that doctor, the pain specialist that you see, is a provider that participates in a new health plan network, then you have to consult with the new primary care provider that they have provided to you, so they can do a pre-authorization to see the pain management doctor. Okay?
Also, because the pain management, okay, so I would have to get another referral to go to the.
You have to see your new provider, your new primary care provider.
Okay.
For a new referral, yes.
Okay.
Somebody else has a question with you.
Yeah, for the adult like apply for Medicaid, they look at the family income, right? Not the individual.
Yes. There are many factors that they are taking in consideration. If you are a single adult, one single adult that makes about, like I said, $1,700, $1,700 per month, then you automatically qualify if you are a citizen, a resident, and a refugee. Now, they take in consideration, just like with a child, your family size and income, okay? So what you need to do is just add about roughly $8,000 more per, or $6,000 more per member, okay? Per year.
Excuse me, a friend asked about if she is now in insurance in Obamacare and she want to switch to the Medicaid.
Okay, I don't know if you have heard about the gap, okay? Many people who did not qualify for Medicaid because they make supposedly too much money, okay? But the amount of money that they made was not enough to cover, to pay for a private insurance. They were considered being in the gap, which in Virginia is about a little more than 400,000 people right now. So those people, many of them will apply with the so-called Obamacare, okay? The Affordable Care Act. Now, many of those people were subsidized by the government, so they would pay a small amount of the monthly fees because what they made was not too much money. Now, those people may qualify for Medicaid. If you happen to have Obamacare, like I said to you, you're a single adult, made $1,700 a month, then you can apply for Medicaid, and Medicaid will cover, because Medicaid is either free or you have a deductible, which is about between $5 and $10 every time you go to a doctor, okay? So it depends on the family, on the family size and your income, okay? Like 2 working adults that happen to have 3 children and they supposedly were making too much money to qualify for Medicaid, now perhaps they might qualify and they have the Obamacare. So they might qualify for Medicaid instead of having the Obamacare and paying the monthly fees that they have to pay for the Obamacare, then won't have to pay anything for the Medicaid. Or just a small deduction, okay?
Can I ask about something?
Sure.
Yes, does the refugee include asylum also? Or
Yes, refugee means anyone who's granted asylum, yes.
Okay, thank you.
I have a question about the Medicaid supplement, which is for people who have Medicare.
Huh?
The people who have Medicare, they have to pay 50%.
Medicare meaning over 65.
No, it could be disabled person.
Medicare?
Yeah, Medicare. So basically, there is an amount that people, they have to pay after Medicare pays the bill. How do you get that supplement Medicaid?
Okay,
50%.
now let me clarify one thing. The people who may qualify now are those between 19 and 64, okay? After 65 years old, traditionally they qualify for Medicare. Medicare is also for people who, like you said, who are disabled. There's a new program, I gave you a flyer over here, called CCC Plus, okay? For people who may qualify for Medicare and Medicaid, okay?
There is a difference between Medicaid and Medicare?
The Medicaid would pay for anything that the Medicare would not cover.
So
Okay.
the Medicare is for the seniors?
Medicare is for
Seniors?
people over 65 or disabled. Okay?
Basically, what are the qualifications for that marriage of 20%?
But it's based on income, basically. And this program, the CCC Plus or the dual SNP also anyone who qualifies for Medicare and Medicaid and has a chronic disease may qualify for a program called dual SNP, which they will have way more benefits. Like with the United Healthcare, anyone who has the dual SNP program may receive about roughly a little more than $2,000 in coverage for dental coverage. Okay? Traditionally, Medicaid right now doesn't cover dental, only for children and pregnant women. I don't know if the Medicaid will cover dental for adults now that it's going to be expanded. Okay? but that's yet to be seen, okay? And did I answer your question? The qualifications for anyone who happen to have Medicare and apply for the Medicaid to be a supplemental insurance is income-based, basically. It's income-based and family size. Okay?
Yes. What new additional benefits? I was hearing about a smartphone offer that SafeLink.
All health plans offer smartphones right now.
Okay, because I just received information about in the mail, and also I also read about rides to farmers markets and stuff like that. Is that what all?
Yes, there will be new. Yes, there will be new benefits with the Medicaid. Like for example, you receive about, I don't know if it's one ride per month to a supermarket or farmer's market to purchase groceries. As you know, you receive, we're talking about transportation before. If anyone who happens to have Medicaid, all health plans offer transportation from your house to the doctor and back, and from your house to the pharmacy to pick up the medicine and back. All you have to do is call about between 3 to 5 business days prior to your appointment to request a transportation. We highly recommend for you to call 5 days before just to ensure and to specify that you want a round trip, okay? Because if you don't say this a round trip, they might take you to the doctor and then you will stop there waiting, they don't come and pick you back because you didn't say it was round trip, okay? Any other question? Any other question? Questions 1? No? Questions 2?
A lot of people, they don't know about the what do you call it for the cell phone?
The cell phone.
Yeah, a lot of people.
The cell phone, okay. Majority of the health plans offer a free cell phone usage, okay, which will provide with unlimited text messaging and about 350 minutes per month, okay? And it's usually, like you said, through SafeLink. All you have to do is just contact your MCO and ask them, your managed care organization, how you can get access to that service. And they will send the phone to you, and you won't have to pay anything.
And you can also go online, SafeLink, and
Yes.
sign up.
And sign up and apply, yes. Any other question?
I know a lot of people, like when they apply for Medicaid, they get confused about the other one. Like when their income increases, like people when their income increases a little bit, they're afraid to lose the Medicaid. So I know there is Incentive Plus, which is goes with Medicaid.
Okay, there are different plans of Medicaid, which is, like you said, Families Plus, okay? Families Plus is for the lower income bracket. Families is for the higher income bracket, even though one says plus, it's for the lower income bracket. Okay, now with Medicaid 4.0, if I'm not wrong, I don't know if it will still be divided in Families Plus, because everyone will be included. Also, have you heard about a program from the state called Plan First? Has anyone over here? Plan First is a free program from the state which provides family planning, okay? For women, offers pap smear, offers also free birth control pills, and also the services for the men as well. Now, if you previously applied already for Plan First, okay, and you qualify into the Plan First, also let me explain to you one thing. Plan First traditionally has no income bracket, so anyone can apply. But when you apply and they see your income, you're already streamlined into the new Medicaid expansion. So if you're already into Plan First, you don't have to reapply for the Medicaid expansion if your income qualifies you. So you automatically will be enrolled into Medicaid. Okay?
I have experience with Plan First, which is when you have Plan First, make sure you cancel it before you apply for Obamacare. Because if you apply for Obamacare, you don't get qualified.
Oh, because of the Plan First?
Oh. Make sure you cancel that and get Obamacare.
Okay. So, so what you're saying is that if you already have Plan First, and you want to apply for the Affordable Care Act, for Obamacare,
You have to make sure you cancel the Plan First.
that's good to know. I didn't hear that before. Does anyone has any other question?
Mr. Folio, yeah, they have a question here. They said, are you offering any interpreter lines or any?
Interpreter lines?
Yeah.
Oh, yes. When you call, there's an interpretation line, okay? What you will specify to them what language do you speak, and they will get someone who translate for you.
And also, if you're interested, if you can provide this lecture again in Arabic. Like you can bring someone from United States here who speaks Arabic and can provide this lecture again, she said.
I can try to find someone who speaks Arabic, yes, definitely so. And just let me know what day, and we'll come over here and do this again. Yes.
You said that dental was expanding too with the programs?
Dental, there are some services there are some services with Medicaid that provides with dental. Like for example, this program, this Medicaid CCC Plus program, the brochure that you have over here, if you see, one of the benefits of this program is dental care, okay? Let me see.
Because now it just pays for like Anthem, just like extraction. It doesn't.
Huh?
Like Anthem now, as far as the services that I use, that I was told it just pays for extraction.
Extractions.
Fillings.
No. But anyone who qualifies for CCC Plus and for the dual plan, meaning that they have Medicare and Medicaid, then they will qualify for dental care. But Medicaid, as it is for adults, right now doesn't cover other than extractions. What I was saying to you is that yet to be seen whether the new expansions adults will receive dental care. Now, as you, that's the brochure about CCC Plus. Yes.
This is the same like Medicaid?
It is a Medicaid plan.
And this is for different, for age, like my mother.
No, CCC Plus is from people with chronic diseases.
Like, okay, because I have chronic disease.
Anyone who's age, blind, disabled, you should have been qualified for CCC Plus.
Okay, because I thought it was an age thing. I didn't know that because I have I go to chronic pain management for
Age, blind, disabled, and chronic diseases.
I didn't know that.
Yes.
So I just called them and when I get my doctor to write a note, and this is just for United. All of them, all the health plans.
All the health plans offer CCC Plus, if I'm not wrong.
CCC Plus is
Yes.
Yes, here it's like.
Oh, okay.
Which means CCC Plus means Commonwealth. Oh my goodness. Commonwealth Coordinated Care Plus, yes. It's for people who has basically chronic and hard to manage diseases.
What is the chronic disease?
That's the issue. Chronic diseases, for example, diabetes can be a chronic disease. But not everyone who happens to have diabetes qualifies for CCC Plus. Who decides that? Who qualifies? The state does. Not the health plan.
What about like degenerative disc disease? Degenerative disc disease, which is
Like I said to you, you have to talk to your provider.
Okay.
The provider has to certify that you have a chronic disease.
Okay.
It has to be passed over to the health plan to the state, and the state will decide whether you will switch over to CCC Plus.
So it's basically an insurance plan in addition to what you already have?
No, you will switch over then. If you do qualify, you will switch over to Medicaid CCC Plus instead of regular Medicaid.
Okay, but it will be listed under Anthem, CCC Plus?
Yes.
Okay, all right.
All health plans offer, okay?
Okay, because all this time, okay. Thank you.
You're welcome. Any other question? Any question? Thank you very much.
Thank you.
Blessings. Assalamu alaikum. Excuse me. By the way, starting November 1st, okay? If you want to apply for Medicaid, there are 3 ways that you can do it.
Okay.
You can apply, but you have to call the state. If you call the number, they can tell you where to go. You can apply by phone, over the internet, or by going to your local social services department.
Okay, that's 211.
Huh?
You got 211.
I think the closest social services department is in Annandale, if I'm not wrong.
Yes.
Okay? The building over there, the big building Annandale. So by going to social services over the phone, okay? Excuse me, over the phone, or is this usual? Or the internet. Now, I will highly recommend to you to apply through social services or in a health clinic like Neighborhood Health. They have navigators that will help you apply. Oh, also, by the way, there's a lady, her name is Griselda Alayon. She started coming to the Culmore Center on Mondays. She will come there on Mondays. She will help you apply for Medicaid and apply for SNAP, food assistance, and all this stuff. Mondays at the Culmore Center. Okay?
Excuse me, do you have address?
The Culmore Center is right by Rite Aid, by the pharmacy down the road.
هذا مكان